Hi, it's Mike Keenan from KM Fitness. Today I want to talk to you about a situation that I see with some of my older clients or clients who have had some injuries in their back. And you may have met with your doctor and he spoke to you about something called spinal stenosis. So let's just clear up a couple things about what happens with spinal stenosis. I have a very crude drawing here, and you can see one of your lumbar vertebrae, and that's typically where the spinal stenosis takes place, in the low back. And you're going to see a circle here in the middle. And that circle represents a foramen, or it's a hole, so to say. And that's where the spinal cord passes through on its way from the brain down to the bottom of your spine. And what happens a lot with spinal stenosis is that there's a small narrowing or an arthritic change in this foramen. In other words, it starts to become smaller. Or what happens is you may have some spurs that develop in there that start to impinge on the spinal cord. And typically the chief complaint with this problem is pain. You'll have pain usually in both legs, sometimes it's just in one, but a lot of times you'll have pain in both legs. And it improves with sitting and made worse by standing. So what we want to do, just for some very simple stretches, is we want to put you into some flexion exercises, okay? So what I want to do today is I want to spend just a few minutes going over some very simple flexion exercises that might help to alleviate your pain. Again, don't start any exercise program until you speak with your physician. Typically, this is very well treated with physical therapy, but a lot of times what happens is people go through their therapy and they're looking to have an ongoing or sustained stretching program. Now, my dad has spinal stenosis, and the exercises that I'm going to show you today are the very same ones that I designed for him many years ago when I was working in physical therapy. And he does these before he gets out of bed in the morning. So I think if I could share them with you, it'd be a great thing. So I'm just going to move my board out of the way. Okay, and then now I'm going to become the client. So you're up in the morning, you wake up. The first thing you're going to do is you want to get out of this straight leg position and you want to bend both knees. And by doing that, that helps to put your spine in a more neutral position. When my legs are fully extended, my back tends to arch or put me into extension. And extension is usually something that makes spinal stenosis worse, where flexion usually makes people feel better. So the first thing I'm going to do is I'm going to grab my right knee, and you could work along with me if you have an iPad or a laptop and you want to set this up and jump on your bed, and you can do them with me, is I'm going to start by bringing my right knee up towards my chest. I'm going to take both hands and I'm going to put them on top of my knee, and I'm just going to draw the knee back towards the chest. Now sometimes what helps with this is how you breathe. So what I want you to do is I want you to take a deep breath through your nose, and then when you blow it out, you're going to draw the knee towards the chest. Just hold for a second or two and then release it. And maybe we'll do that 2 or 3 times. So let's do that again. And draw the knee up towards the chest. And then of course you would do that with the other side. So let's go ahead and do that. Deep breath in, blow it out. Now again, if any of these exercises increase your pain, you're to stop them immediately. Deep breath in. Let's blow it out. And then down. Okay, now if you want to be a little more aggressive, you want to try to increase your flexion a little bit, you can always bring your knee up towards your chest and bring your head or lift your head at the same time. So it would look like this. Just like that. Put it down, and we'll go ahead and do the other side. Great. Okay, now you can do both knees at the same time, as long as it doesn't provoke pain by lifting the legs. You take the legs up, breathe in, blow it out. And what I'm doing is I'm causing a separation of my vertebrae. I'm separating the joints in my low back, and I'm trying to relieve pressure on my low back by doing a flexion exercise. Okay, the next exercise I want to do is I want to bring that knee back up to the chest. I'm going to take my right hand, put it on the inside of my right thigh, and I'm just going to inhale. I'm going to blow it out. I'm just going to open up the hip and let the leg drop to the side. Now, part of the reason I'm doing this is I'm trying to increase the amount of flexibility in my hips, especially my hip flexors. If my hip flexors are tight, they're going to pull on my lumbar spine. They're going to pull the lumbar spine more into a lordotic curve or an extension curve, and that can also make the pain of spinal stenosis much worse. Okay, so we do that, put the leg down, and we do that 2 or 3 times, and then we reach across with the left hand. This is where I kind of cross my leg over, and I pull up and across. So I inhaled, I exhale. Okay, now just be careful to make sure you keep the right shoulder down, and don't over-rotate, because that could cause more problems with the back. So you just really want to focus the stretch more on the hip and the glutes, the piriformis muscle, and just pull up and across. And just try to stretch all the tissue out in the low back and through the hip. Okay, then I might return my leg back down and then do the other side. Now I'm going to take my left hand and I'm going to open up the opposite side. Just like that. Good. Put the leg back down. Switch, cross over. Pull up and across just until you feel a stretch through the hips and the buttocks on the other side. There you go. That's great. Okay. The next exercise we're going to do is you're going to lay on your side. So you'd be facing this way, laying on your right side. Now, I have to get up a second and grab my towel because I left it over here. Earlier, I mentioned to you that we want to stretch out the hip flexors. Okay? So the way I would do it, because I don't have spinal stenosis, I would just grab my ankle and pull back. But for many of you, that trying to get into that position is going to throw your spine into extension and make you feel a whole lot worse. So what you're going to do is you're going to take a towel. You can even take a bath towel that's much longer than this. You're going to put it around the foot and ankle, just like that. Okay? You're going to make it back onto your side, and you're going to draw the leg back until you feel a stretch through the thigh and the front part of this top hip. So you're going to inhale, blow it out, and just pull back until you feel a stretch. This should be pain-free in your back. Okay, and you would do that 2 or 3 times. Good, just like that. And then, of course, I would do the other side. So I would sit up, flip over to the other side. Down, deep breath in, blow it out, pull back till you feel a stretch. Good. Now if any of you are golfers and you don't have back problems, you can also use all these stretchers as well, because they'll help to loosen up your hips and your low back before you play. Great. Okay, go ahead and sit up. That's the only important thing too. When you go to sit up, I would lay on my side and roll and try to push myself up in a unit. Now, if you're sitting in a chair, another exercise you can do just to help stretch out the low back is just take your hands, put them on your thighs, and just slowly come forward. And this also helps. I'm doing it sitting on a table, but you certainly could do this in a chair. And that flexion will help to open up the spine a little bit and hopefully relieve some of your tightness or stiffness or pain that you might have. Again, I can't reiterate enough that you really need to be treated by a physician. For spinal stenosis, this isn't something you should try to treat on your own. Typically, the next progression after seeing the physician, he'll usually prescribe physical therapy, which is a great way of treating it. But again, this is more for the people who've gone to the doctor, been through therapy, and now you're looking for something ongoing that you can do every day before you get out of bed. And I know my dad does these stretches every day. It certainly makes him feel a whole lot better. If you have any questions or concerns, feel free to reach out to me at KM Fitness here in Manasquan. And we'll see you next time. Take care. Bye-bye.